Warning: if you wake up every morning with that deep, grinding ache in your hip, if you find yourself gripping the bedpost just to stand up, if you have stopped going to the grocery store because walking through those aisles feels like walking through wet concrete, then what I am about to share with you could change everything in the next 14 days. Dorothy came into my office 3 weeks ago. She is 72 years old, a retired librarian from Portland, and she told me something I will never forget. She said, "Dr. Harrison, I used to walk 2 miles every morning with my husband before he passed. Now I cannot even walk to the mailbox. My granddaughter asked me to dance at her wedding next month, and I had to tell her I could not do it." And when she said that, her voice cracked. She looked at me with tears in her eyes and said, "I feel like I am disappearing." That moment broke my heart, because Dorothy is not alone. In my 31 years as an orthopedic specialist, I have seen thousands of patients just like her. Good people, active people, people who did everything right their whole lives, and now they wake up every single morning feeling like their own body has turned against them. But here is what the medical community rarely talks about. There is one simple exercise, something you can do in your own bedroom in less than 3 minutes, that has helped hundreds of my patients go from barely being able to stand up in the morning to walking, gardening, even dancing again. And no, it is not stretching, it is not yoga, it is not some complicated routine you need special equipment for. What I am about to share with you has been sitting right under our noses this whole time, and once you understand why your hip hurts in the first place, you will see exactly why this works. Now, before I go any further, I want to be clear about something important. While I am a physician sharing evidence-based information, this video is for educational purposes only. It is not a substitute for personalized medical advice from your own doctor, who knows your specific health history. Always consult with your healthcare provider before making any changes to your health regimen. That said, let's get into it. Let me tell you about Robert. Robert is 68, a retired firefighter from Chicago. Strong man, proud man, the kind of guy who spent his whole career carrying people out of burning buildings. When he came to see me, he could barely sit in the waiting room chair. Robert looked at me with frustration written all over his face and said, "Doc, I have tried everything. The pills, the creams, those exercises from the internet. I even bought one of those fancy massage guns. Nothing works. I am starting to think this is just what getting old feels like." I hear that more than you would believe. People think hip pain is just part of aging, like gray hair or wrinkles. But that is simply not true. Here is what is really happening inside your hip, and I am going to explain it in a way that actually makes sense. Imagine your hip joint is like a door hinge. When that hinge is brand new, it swings open and closed smoothly, right? The door moves easily, no noise, no resistance. That is what a healthy hip feels like when you are young. But now imagine that same door hinge after 40 or 50 years. It has been opening and closing thousands of times. The metal has started to wear down. Rust is building up in the creases, and one day you go to open that door and it creaks, it sticks, it fights you every single time you try to move it. That is exactly what is happening in your hip. But here is the part most people do not understand. It is not the bone that is the main problem, it is what surrounds the bone. Think of it like this. Around your hip joint, you have these small muscles that work like a team of little workers. Their job is to keep your hip stable, to guide every movement, to make sure that when you take a step, your leg moves exactly the way it should. But over the years, something happens to these little workers. They get lazy, they get weak, and when they stop doing their job, everything falls apart. Let me give you another way to picture this. Think of your hip like a tent. You have the main pole in the middle, that is your bone. But what keeps the tent standing upright? It is not the pole by itself. It is all those guy wires, those ropes that anchor the tent to the ground in every direction. Those guy wires are like the small stabilizing muscles around your hip. When those guy wires are tight and strong, the tent stands perfectly straight. Even in a storm, it holds steady. But if those guy wires start to loosen, if they lose their tension, what happens? The tent starts to wobble. It leans to one side, it flaps around, and eventually things start to break down. That is what happens in your hip. When those deep stabilizing muscles weaken, the joint starts to wobble. It loses its precision, and that wobbling creates friction, inflammation, and pain. It is like having a door with rusty hinges, but the real problem is that the screws holding the hinges in place have come loose. You can oil that hinge all day long, but if the screws are loose, the door is still going to stick and groan every time you open it. That is why stretching alone does not fix hip pain. Stretching is like oiling a hinge with loose screws. It might feel good for a moment, but the underlying problem is still there. Margaret understood this right away. She is 65, a grandmother of 4 from Austin, Texas, former dance teacher. When she came to see me, she was using a cane. A cane. This woman, who spent 30 years teaching people how to move gracefully, could barely walk across my office. She said to me, "Doctor, I have been doing stretches every single day for 2 years. My physical therapist gave me a whole routine, but I am not getting better. I feel like I am getting worse." And she was right. The stretches were not enough, because stretches work on flexibility, but they do not wake up those little workers around your hip. They do not tighten those loose screws. What Margaret needed, what Dorothy needed, what Robert needed, what you probably need right now, is something that goes deeper. Now, before I tell you what this exercise is, I need you to understand something important. Your hip is not broken. You are not falling apart. What is happening inside your body right now is completely natural. It is like a garden that has not been tended in a while. The weeds have grown up, the flowers have wilted, but the soil is still good. The roots are still there. It just needs the right kind of care. And that is exactly what this exercise provides. Walter came to me 6 months ago. He is 71, a retired postal worker from Minneapolis. Walked his route for 35 years, rain or shine. But when he retired, everything changed. Walter told me, "Doc, I do not understand it. I walked 10 miles a day for 35 years, never had any problems. But 6 months after I retired, my hip started aching. Now it hurts to get out of bed. It hurts to sit in my recliner. It even hurts when I am lying down." What happened to me? What happened to Walter is what happens to so many people. When you are active, when you are walking 10 miles a day, those little muscles around your hip are constantly working. They stay strong, they stay engaged, they keep everything aligned. But when you stop moving as much, when you retire, when you start spending more time in chairs and less time on your feet, those muscles start to fade. It is like what happens to an unused path in the forest. Grass grows over it, branches fall across it. Within a few months, you can barely see where the path used to be. That path is still there. It just needs to be cleared again. And that is what I told Walter. I said, "Walter, your hip is not damaged beyond repair. It is just sleeping. We need to wake it up." He looked at me skeptically and said, "Doc, I have been doing those leg lifts my daughter showed me from some video. They do not help." And I explained to him what I am going to explain to you right now. Most hip exercises people try are working on the wrong thing entirely. They are focused on the big muscles, the ones you can see, but the muscles that actually control your hip stability are deeper, smaller, and they need a very specific kind of movement to wake up. This is where the exercise comes in. It is called a hip rotational bridge, and it is probably the most effective thing I have ever discovered for hip pain in my 31 years of practice. Here is how it works, and listen carefully, because the details matter. You lie on your back, just like you are about to do a normal bridge, knees bent, feet flat on the ground, but instead of just pushing your hips straight up, you add a small rotation, a tiny twist, and that small twist is what activates those deep muscles that have been sleeping. It is like the difference between turning a key in a lock versus just pushing on a door. You can push on a locked door all day long and nothing will happen, but one small turn of the key and suddenly the door swings open. That twist in the hip rotational bridge is the key. It unlocks those deep muscles. It sends a signal to your brain that says, "Hey, wake up, we need you." Let me explain what happens inside your body when you do this movement. When you add that small rotation, you are activating muscles called the hip external rotators. These include the piriformis, the obturator muscles, and the gemelli. Now, you do not need to remember those names. What matters is understanding what they do. These muscles wrap around the back of your hip joint like a protective sleeve. When they are strong and active, they hold your hip in perfect alignment. They prevent that wobbling I talked about earlier. They are the difference between a smooth, quiet hip and one that grinds and aches with every step. The problem is, these muscles are hard to activate with normal exercises. Regular bridges do not reach them. Leg lifts miss them entirely. Even most stretches bypass them completely. But when you add that rotational component, you are essentially shining a spotlight directly on these muscles. You are telling your nervous system, "I need these specific muscles to engage right now," and your body responds. The first few times you do it, you might feel a slight trembling. That is completely normal. That is those muscles waking up, like someone who has been asleep for a long time and is just now stretching and yawning and coming back to life. And here is the beautiful thing. You do not need to do it for an hour. You do not need to do it until you are sweating and exhausted. You just need to do it for 2 to 3 minutes every morning, right when you wake up. Think of it like jump-starting a car battery. You do not need to run the engine for hours. Just a few minutes of connection, and the battery starts charging on its own. Let me tell you about someone who really taught me the power of this exercise. Her name is Eleanor. She is 76, a retired school teacher from Philadelphia, taught third grade for 43 years. When Eleanor came to see me, she had not been able to sit on the floor with her grandchildren in over 3 years. Eleanor told me, with tears in her eyes, "Dr. Harrison, my grandson is 4 years old. He wants to play with blocks on the floor. He wants me to sit with him. And every time I try, the pain is so bad I have to get up after 30 seconds. I see the confusion in his face. He does not understand why grandma cannot play with him." That broke me, because playing with grandchildren, that is not a luxury. That is one of the great joys of this stage of life. And hip pain was stealing it from her. I taught Eleanor the hip rotational bridge that very day. I showed her exactly how to do it. She was skeptical, I could tell. She had seen specialists before. She had tried injections. Nothing had worked. But Eleanor did something that changed everything. She committed. She did the exercise every single morning without fail. She treated it like brushing her teeth, something she just did without question. After 10 days, Eleanor called me. Her voice sounded different, lighter somehow. She said, "Dr. Harrison, I sat on the floor with my grandson for 15 minutes yesterday. 15 minutes. We built a tower of blocks together, and when he knocked it down and laughed, I laughed with him. I had forgotten what that felt like." By the end of the month, Eleanor was getting down on the floor and back up again without help. Her grandson had no idea that anything had ever been wrong. To him, grandma was just grandma again. That is what this exercise can do when you commit to it. Let me tell you what happened to Dorothy, the librarian. I told you about at the beginning. Dorothy started doing the hip rotational bridge every morning, just like I showed her. Just 2 minutes. Nothing extreme. She could do it right in her bed before she even put her feet on the floor. After the first 3 days, she noticed something. The morning stiffness was not quite as bad. It usually took her 20 minutes to loosen up enough to walk to the kitchen. Now it was taking 10. After 1 week, she called my office. She was excited. She said, "Dr. Harrison, I walked to my mailbox this morning. I have not done that in 8 months. My neighbor saw me and thought something was wrong because I was outside." After 2 weeks, Dorothy was walking around her entire block. Her daughter called me, confused, asking what I had done to her mother. And here is the part that still gives me chills. 1 month later, Dorothy called me from her granddaughter's wedding. She was crying, happy tears. She said, "Doctor, I danced, not for long, just one song, but I danced with my granddaughter on her wedding day, and I never thought I would be able to do that again." That is what this exercise can do. Not in 6 months, not after expensive surgeries or endless physical therapy appointments, in days, weeks. But I need to explain exactly how to do it because the technique matters. You start on your back, knees bent at about 90 degrees, like you are going to do a sit-up, feet flat on the floor, about hip-width apart, arms relaxed at your sides. Now here is the key. Before you lift your hips at all, you are going to create a small rotation. Think of your belly button as the center of a clock. You are going to rotate that clock slightly to the left, maybe to the 10 o'clock position, just a few degrees, nothing dramatic. Then holding that tiny rotation, you slowly lift your hips up until your body forms a straight line from your shoulders to your knees, like a bridge. Hold that for 3 seconds. Really feel those muscles on the left side of your hip working. They might tremble a little. That is good. That means they are waking up. Then slowly lower back down, reset to neutral, and rotate to the other side, to the 2 o'clock position. Lift again. Hold for 3 seconds. Lower down. That is 1 repetition. You do 10 repetitions, 5 to the left, 5 to the right, alternating. The whole thing takes about 2 minutes, maybe 2.5 if you are moving slowly, which I recommend when you are starting. Let me be specific about what you should feel during this exercise. When you add that rotation and lift into the bridge, you should feel a subtle engagement deep in the outside and back of your hip. It is not a burning sensation like you might feel in your thighs during a regular exercise. It is more like a gentle tightening, an awakening. If you feel sharp pain, stop. If you feel discomfort in your lower back, you may be arching too much. Keep your movements small and controlled. This is not about how high you can lift or how far you can rotate. It is about precision. It is about sending the right signal to the right muscles. It is like winding a watch. Each morning you give those muscles a little wind, a little activation, and throughout the day they keep working for you. keeping your hip stable, keeping the pain away. Robert, the firefighter, was the most skeptical patient I have ever had. He told me straight up, "Doc, this sounds too simple. I have spent hundreds of dollars on treatments. You are telling me laying on my back and wiggling a little is going to fix this?" I told him, "Robert, I am not telling you it will work. I am asking you to try it for 14 days. If it does not help, you have lost nothing but a few minutes each morning." 3 weeks later, Robert walked into my office without his cane, without the grimace he used to have every time he sat down. He shook my hand, harder than he probably should have, and he said, "Doc, I climbed the stairs at my daughter's house yesterday. 14 steps. I have been avoiding those stairs for 2 years. That is the power of waking up those deep muscles. Once they start doing their job again, everything changes." Now I want to address something important. Some of you might be thinking, if this is so simple, why did not my doctor tell me about this? And the answer is complicated. In medical school, we spend a lot of time learning about the big things, the surgeries, the medications, the dramatic interventions, but these small targeted movements, they are not glamorous. They do not make headlines. Nobody is getting rich teaching people how to do a 2-minute exercise in their bedroom. But sometimes the most powerful solutions are the simplest ones. It is like how drinking a glass of water can stop a headache. Nobody makes money on that advice, so you do not hear about it. But it works. I want to pause here and remind you of something important. I am not suggesting you stop any treatments your doctor has prescribed. What I am sharing today may inform a conversation with your physician, but any changes to your care should only be made under their guidance. Helen learned this lesson too. She is 69, a retired nurse from Cleveland, spent her career on her feet, taking care of other people, and when her hip started hurting, she just pushed through it. She said, "I took care of sick people for 40 years. I can handle a little discomfort." But a little discomfort turned into a lot of discomfort, and by the time she came to see me, she was struggling to get through her day. Helen told me, with frustration in her voice, "Doctor, I feel like my body has betrayed me. I took care of it. I ate right. I exercised. Why is this happening?" I explained to her what I explained to you, that her muscles had not betrayed her. They had just gone quiet, like workers who show up every day but have stopped doing their jobs because nobody is supervising them anymore. The hip rotational bridge is the supervisor. It tells those muscles, "I see you, I need you, get back to work." Helen started the exercise on a Monday. By Thursday she told me she forgot about her hip for the first time in 2 years. Just forgot about it. Did not think about it once while she was cooking dinner. That is when you know the healing has started, when the pain stops demanding your attention. Within 3 weeks, Helen was back to her walking routine, a mile every morning. She called me and said, "Dr. Harrison, I feel like I got 5 years of my life back. 5 years, from a 2-minute exercise." Now I want to be clear about something. This exercise is not a magic cure. It is not going to help everyone with every type of hip problem. If you have had a major injury, if you are dealing with severe damage, you should absolutely see a specialist. But for the vast majority of people over 60 who wake up with that grinding, aching hip pain, the kind that makes you feel old before your time, this exercise can be transformative. Because here is what most people do not realize. That pain you feel every morning is not a sign that something is permanently broken. It is a signal. It is your body asking for help. It is like a warning light on your car dashboard. The light is not the problem. The light is telling you there is a problem. And if you respond to that signal with the right action, the light goes off. The hip rotational bridge is the right action. It is the oil change your hip has been asking for. It is the tune-up your body needs. And the beautiful thing is, you can start tonight or tomorrow morning. You do not need to buy anything. You do not need to go anywhere. You just need a flat surface, 2 minutes, and the willingness to try. George was 74 when he came to see me, retired mechanic from Detroit, hands like baseball gloves from years of working on engines. He told me, "Doc, I have been fixing cars my whole life. I know how machines work, and I am telling you, my hip is broken. It is just worn out." I said, "George, you are right that you know how machines work. So let me ask you something. If you had a car that was making a grinding noise and you found out that one of the belts had just slipped out of alignment, would you junk the whole car, or would you try adjusting that belt first?" He looked at me for a long moment, then he said, "I would adjust the belt." I said, "That is exactly what we are going to do with your hip." 6 weeks later, George was working on his grandson's bicycle in the driveway, squatting down, getting up, moving freely. He sent me a picture of the finished bike with a note that said, "Belt adjusted, running smooth." That is what I want for you. I want you to run smooth again. because you deserve it. You have worked hard your whole life. You have taken care of your family. You have shown up day after day, year after year, and this pain that you are feeling now, it does not have to be your story. I think about Dorothy at that wedding, dancing with her granddaughter. I think about Robert climbing those stairs, Helen forgetting her hip existed, Walter walking the neighborhood again, like he used to walk his postal route, Eleanor sitting on the floor with her grandson. These are not miracles. These are simply what happens when you give your body what it needs. Your hip is like that neglected garden I mentioned. The flowers have wilted, the weeds have grown, but the soil is still rich, the roots are still strong, and with just a little attention, just a few minutes of the right care each morning, those flowers can bloom again. The hip rotational bridge is the gardening. It is the water and sunlight your muscles have been craving. Here is my challenge to you. For the next 14 days, I want you to do this exercise every single morning, right when you wake up, before your feet even hit the floor, if you can manage it. 2 minutes, 10 repetitions, that rotation to the left, then to the right. By day 7, you should notice something different. Maybe it is a little less stiffness. Maybe you can stand up a little faster. Maybe you walk to the kitchen without that familiar wince. By day 14, I believe you will understand exactly what Dorothy, Robert, Helen, Walter, Eleanor, and George experienced. That feeling of I cannot believe it was this simple, because sometimes it really is that simple. Sometimes the key to unlocking years of pain is just a small twist, a gentle rotation, a 2-minute commitment every single morning. Your hip has been waiting for this. Your body has been asking for this, and now you know exactly what to do. In my 31 years of practice, I have seen the expensive treatments, the surgeries that take months to recover from, the medications that dull the pain but never fix the problem, and all of those have their place. But there is something profound about giving people their independence back with something they can do themselves, in their own home, in their own time. And remember, this information is meant to educate and empower you, not replace the advice of your personal physician. Take what you have learned today and have a conversation with your doctor about what is right for you. Dorothy told me something on our last visit that I think about often. She said, "Dr. Harrison, you did not just fix my hip, you gave me back my confidence." I started to think I was just going to shrink, get smaller and smaller, until I disappeared. But now I feel like I am growing again at 72, because of a 2-minute exercise. That is the power of waking up those deep muscles. It is not just about the hip. It is about everything that hip connects you to. Your walks, your garden, your grandchildren, your sense of yourself as a capable, independent person. So tonight, or tomorrow morning, I want you to try it. Lie on your back, feel that floor beneath you, and start that small rotation. Wake up those muscles that have been sleeping. And in 14 days, I think you will be amazed at how much can change. Because your body is not broken. It is just waiting for the right signal, waiting for you to turn that key. The door is ready to open. All you have to do is turn it. If you found this helpful, if you learned something today that you can use, I would really appreciate it if you subscribed. I release new videos every week specifically designed to help you take control of your health and maintain your independence as you get older. And I promise to always give you the science without the hype. If you know someone who is struggling with this kind of pain, someone who has started avoiding walks, or stairs, or time with their family because their hip just hurts too much, please share this with them. Sometimes all we need is for someone to say, "Hey, listen to this, it might help," and it just might change everything. Take care of yourself.